Obamacare starting the new year in critical condition. The Republican tax plan dealing a major blow to the health care law by eliminating the individual mandate. President Trump touted the move as essentially killing the Affordable Care Act. Meanwhile, some Republicans are still pushing for a full repeal and replace. They want to see another attempt at health care reform in 2018, despite the defeat in Congress last year. Joining us this morning is former policy director for Mitt Romney, senior advisor to Marco Rubio, and research fellow at the Hoover Institute, Lanhee Chen. Lanhee, good to see you. Good morning, sir.
Morning, Maria.
What's your take on all of this? You think Republicans can succeed where they failed last year in terms of a repeal and replace?
Yeah, I don't know that the dynamics are a whole lot different, Maria. I do think they are going to try again. I think there's going to be tremendous political pressure on them to do so. And I do think, by the way, that zeroing out the individual mandate in the tax bill, really kind of getting rid of that individual mandate, is going to create some pressure for Republicans to act, because what you are going to see in some markets is dwindling competition. You're going to see fewer people in markets. And frankly, there's going to be a demand for more choice out there. That was one of the challenges under Obamacare, is that people don't have the choice of insurance plans they want, and that is going to create some demand on policymakers to act to create the conditions so that choice can exist.
Lanhee, it's Lindsay Bell here. My question for you is, what is the biggest opportunity for Republicans as they face health care going into 2018? Based on what you just said, where do they start?
Well, really what this gets back to, I think, is giving states the freedom and flexibility to craft health care plans that work for their citizens. This was really the basis of the so-called Cassidy-Graham reforms that we saw toward the end of 2017. This was the last-ditch effort, you may recall, last fall, to try and repeal and replace the Affordable Care Act, Obamacare, with some options for states. And I think that is going to be the basis of Republican activity on Obamacare in 2018. And I think that's the best place to go, because that's the only principle on which I think all Republicans will agree, that we got to give states more power to craft those health care solutions and indeed take it away from the federal government. So I think that's where we're going to see the action start. The big question is going to be, is there sufficient agreement within the Republican conference, particularly in the Senate, to move forward? Remember, they have one less vote with the election in Alabama, so this is going to be a little bit more challenging.
Lanhee, hi. Jason Chaffetz here. It's good to see you bright and early out on the West Coast. Paul Ryan, the speaker, has been talking about entitlement reform, Medicaid, Medicare. Is there really room to tackle that? Are we able to put something forward that could maybe get some bipartisan support, or are Republicans going to have to try to go alone on this one?
Boy, Congressman, I sure hope so. I sure hope we can do something on entitlement reform, because if you look at what the challenges are going forward, you know, we've talked about this for a long time. You were leader in the Congress on this. We've got to figure out some way to get our spending under control. And it's not about the discretionary side of the House. It's really about the mandatory or entitlement spending that the country is engaging in now. That is Medicare, that is Social Security, and there are some common sense reforms I'd hope we can all agree on, and that is an area where there's an opportunity here. I don't know whether there's any oxygen for it, though. That's the problem. I think Paul Ryan and a lot of folks in the House want to do it. I'm not sure about the Senate side, and I'm not sure about President Trump on this. So we're going to have to see. But if there is to be a long-lasting solution to the fiscal crisis, it's going to involve entitlement reform.
But it's not a crisis, Lanhee. That's why these lawmakers won't deal with it, because maybe they'll deal with it when interest rates skyrocket, or even if they go up even slightly on the longer end. We will not be able to afford this. Here are some basic numbers. In 7 years, Medicaid spending, and the Republicans did try and reform Medicaid last year and failed at it. Medicaid spending in this country, this is federally and state-funded health insurance, $929 billion. Defense spending will be about $200 billion less than that. And if you look at all discretionary spending, it comes in just over $700 billion based on these estimates. So basically, we're turning into a nation that is going to be swamped by these health costs.
Yeah.
And they won't do anything about it. And it's infuriating. And we talk about the risk. This is a bomb that's going to blow up in our faces.
I don't think they're going to do anything in terms of cutting back in an election year. Do you? I mean, going into 2018 in these midterm elections, you're going to see a lot of pictures of Granny going off the cliff if, in fact, you actually do see change coming from the Republicans.
Mitch
Isn't that right?
McConnell said that they're not touching Social Security and Medicaid.
Why would they this year ahead of 2018?
Lanhee Chen is exactly spot on right. It is the #1 thing you have to do in order to get your fiscal house in order. But the political will from the president is just not there. And I do think there's a reluctance, particularly in the Senate. I think Lanhee's right on this one.
So
yeah,
what do
I
you
think
do,
this is
Lanhee?
the big challenge in election year.
I mean, the budget,
well,
the last budget, what are we talking about? $47 trillion budget with what kind of cutbacks?
$47 trillion over 10 years.
No spending cut.
$1
billion in spending cuts on a $47 trillion budget.
Well, to Dagan's point, really, Medicaid is one place where they can start. And Republicans did try to do this to their credit last year with these Obamacare bills. And one of the things that they could do here with Medicaid is to restore some sense of fiscal sanity here by saying, look, we are going to give states a capped amount that they can spend every year. They can spend it how they want to spend it, but we're going to cap the amount that they spend. The challenge is with an election year coming, that's going to be even more difficult. So I think you all are right. This is going to be a tough year to get this done. But the crisis is here. You talk about states. Here in California, Medicaid is spending California into oblivion. We're going toward bankruptcy here in California precisely because we're spending too much on Medicaid.
Yeah.
So these challenges are getting bigger. They're not getting smaller.
By the way, right now, we're facing the defense story and whether or not those budget caps are going to be removed. You mentioned, Dagan, the lower numbers in terms of military spending. Jack Keane has said this on this program many times. 50% of the planes in the Navy are not flyable. I mean, what do you do, Jason?
Defense hawks are going to win this war.
They are.
Within the Congress, they're going to win it. They're going to get more money. They're going to get their funding, and that's going to be the impetus for the Democrats to say, well, for every dollar increase in defense spending, you're going to have to increase social spending within the budget.
This does get to the discussion of what is the role of the federal government? Is it to provide garbage health insurance like Medicaid, which has poor outcomes, to a giant swath of the country? Or is it to basically protect the United States? What are we going to spend money on? And right now, with interest rates low, you can borrow at about 2.5% a year over 10 years. They don't need to worry about answering these questions. But the day is going to come, and it might show up sooner than they think, that they're going to have to.
Yeah, and how about the day when 50% of the planes in the Navy are not flyable? Given the threats around the world, should we be cutting back and putting caps and keeping these caps in place for defense spending? I don't think so.
But those sequester cuts were put in place in order to force some sort of spending restraint. They were put in place, in 2011, in order to at least force these politicians to make these tough choices, and they're not making them.
These are tough choices, there's no doubt about it.
North Korea threat then either.
The North Korea threat, the ISIS threat.